And one of the suggestions just to help with all of this, the easy workload that GPs clearly have is a 6-day working week. That's one of the suggestions to deal with the backlog. What are your thoughts on that? Dr. Patterson, maybe we'll start with you.
Where do we start? Well, okay, so NHS staff work a lot of unpaid hours already.
Exactly.
I suppose that's probably the message here. Anita, I don't know how many hours you work. You work full time, but I don't know how many hours that is. But most of the GPs that I speak to every day, they're contracted to work a particular number of hours, but they work far beyond that because they're responsible for a population of patients, and actually you just work until the work's done. Yeah. And that's true in all roles in the NHS really, because you're responsible for the safety of your patients. I've heard, you were touching on morale just then, Anita, and I just want to kind of echo what you're saying there. It's difficult, really difficult for staff to talk about this themselves. Some of the people in our network have been writing opinion pieces anonymously for the papers recently. They haven't wanted to put their names to things because it's very, very difficult to reveal how much this situation is impacting on people and their families, and their personal lives, their mental health. And I think I can probably say this with freedom now because I don't work clinically anymore. But it's very, very difficult to admit that you're struggling. We are a workforce of people who've been taught to be resilient in very difficult situations. That's just the training that you have. And any admission that you're struggling it's not so much that it's looked down on, but everyone's under a lot of pressure. Yeah. And so it's quite difficult to admit that you're having a difficult time. My background is as a psychiatry doctor, and I'm quite close to a lot of doctors who I talk to online, and they've been talking to me over the last 3 years, 4 years or whatever, so I kind of get updates about how things are going. I've had a few emails recently of doctors who I know quite well who are suicidal, and the ones who have spoken to me are doing it because they feel a bit better now. They're kind of in recovery, they've had some support, and they want things to change, and that's the reason they've come to me, and we're talking about it. But I'm desperately concerned. There's a real problem with not just suicides and suicidality, but people with anxiety and depression, OCD, post-traumatic stress disorder after the pandemic. And none of this is really focused on because it's like everyone's running at 100% all the time. Go, 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 adrenaline. I hear about a lot of doctors who take a bit of annual leave, and it's when they take the leave that they crash, actually, because they allow themselves to stop. So I've probably gone off at a bit of a tangent here, but I think sometimes what we see in the papers is the headlines of how everything's urgent, and staff, particularly during those times when there's a focus on crisis, like winter crisis, what we've seen over the last 6 weeks or so, staff will go up to the microphone and will be talking, and they talk in a very strong way, don't they? There's a lot of talk about we're going to keep patients safe, we're going to do everything we can, people go above and beyond. But what gets missed, I think, sometimes is that all of that takes a toll on the staff. And we're talking about pay. Pay is important, but quite honestly, like I run a network of doctors, and over the last 3 years, we considered twice running a campaign about NHS staff pay. And the doctors that I represent twice said, I don't want you to run that campaign. I don't want the team to run that campaign. Pay isn't the thing I want. It's better conditions. It's feeling like I have enough staff in my team. It's feeling like I can have a coffee break. I mean, I wasn't able to campaign for those things very effectively. We try and talk about, so pay is really important. I don't want to sound unsupportive of anyone campaigning for pay. I think it's really important, but it's one of the things.
Yeah, exactly. It's one of the things. And you asked me that question about the hours. So let's put things into perspective. When I read the papers, I find it quite astonishing, actually quite amusing, when there are lots of nasty comments about all these GPs who are part-timers working 3 days a week, lazy, don't want to do their work. Let me tell you how many hours a part-time GP works. If you're working 3 days a week, which is a 6 session, you're actually doing 40 hours a week, which would be equivalent to anybody else doing full-time work. So if a GP is doing 4 days a week, they're probably doing 60 hours. And if a GP is doing 5 days a week, they're doing more than 100 hours. I know GPs who get into the building 8 o'clock in the morning and do not leave before 9 o'clock. So it is a very, very stressful job.